thank you for watching the video. This is YouTube Medical University. Suddenly, let me ask, do you remember your own blood pressure numbers? Recently, my upper blood pressure went up to 150. Or maybe you've thought, for some reason, only my lower blood pressure is high. What does that mean? By the way, why do we medical professionals measure both the upper and lower blood pressure? Actually, the upper and lower blood pressure numbers hide important information about the condition of your blood vessels. Surprisingly, this isn't something you're often told at the hospital, right? Maybe you remember the standard for the upper blood pressure, but think, well, the lower one doesn't matter as much. But actually, the lower blood pressure is also a very important value that tells you about significant changes in your blood vessels. And as you get older, sometimes patients in their 80s or 90s ask, my lower blood pressure has gone down. Is that a good thing? Actually, recent studies have suggested that having a lower blood pressure that's too low might also increase the risk of future illnesses. Nowadays, it's said that 1 in 3 Japanese people has high blood pressure. Whether the upper or lower blood pressure is more important can also depend on your age. I'll explain what upper and lower blood pressure values mean. And which blood pressure value should you pay more attention to? I'll explain these points clearly from a doctor's perspective. In the second half of the video, I'll discuss measuring blood pressure. Some people say their readings vary and they aren't sure which to trust, or they check it daily but question if they're doing it right. To answer these questions, I'll introduce the correct way to measure blood pressure as recommended by doctors. In fact, I've had patients who measured their blood pressure in their own way for many years, and because of that, their readings were high. But when they measured it correctly, their blood pressure was actually normal, and they didn't need any medication. Taking blood pressure medication unnecessarily can cause low blood pressure and fainting, which is dangerous. So, in this first session, we have upper and lower blood pressure values. In the second session, the real reason why the lower blood pressure increases. And in the third session, what happens if the lower blood pressure drops and the unexpected risks involved. And in the fourth session, which matters more for your age, upper or lower blood pressure. In the fifth session, I will explain the 5 key points you must know to measure your blood pressure correctly. At YouTube Medical University, we share easy to understand videos from a doctor's perspective that can help you become healthier starting tomorrow. Please subscribe to the channel so you don't miss new videos. It encourages me. So, in this first session, I'll briefly explain the meaning of having 2 blood pressure numbers, the upper and lower values. Have you ever felt your heartbeat? There are times when you can feel that thumping, right? That thumping is when your heart is contracting. When your heart contracts, you can imagine blood flowing strongly through your body, causing very high pressure in your blood vessels. This is called systolic blood pressure, which is the blood pressure when the heart contracts. This is what is commonly referred to as the upper blood pressure. It's simple up to this point, right? So what is the lower blood pressure? To put it simply, please understand it as the blood pressure during the relaxed period after the heart contracts. After the heart contracts, it expands again, right? This is called the diastolic phase, so the lower blood pressure is called diastolic blood pressure. Since the heart is expanding, you might think that blood isn't flowing throughout the body and the blood pressure would drop to 0, right? But actually, that's not the case. Please take a look at this illustration. This is the aorta, the largest blood vessel that runs throughout the body and is connected directly to the heart. This aorta is actually very flexible, like a rubber tube. When the heart contracts tightly, blood flows rapidly from the heart. The aorta swells up thick and full like this. And then, after the heart finishes contracting and enters the diastolic phase, this swollen aorta, which is elastic like rubber, gradually contracts and becomes smaller. The blood flow branches off from the aorta to organs like the liver and kidneys and flows into all sorts of organs. This pressure at this time is called diastolic pressure. The aorta is swollen, so the heart is in diastole. During this time, blood vessel pressure is kept stable by their rubber-like elasticity and flexibility. Diastolic blood pressure shows how flexible and elastic the vessels are. I think you get this, so let's review again. The upper blood pressure is the systolic blood pressure. It is the blood pressure when the heart contracts and represents the force with which the heart pumps out blood. And the diastolic blood pressure is the pressure when the aorta expands and then contracts to send blood flow to all the organs in the body. Now, in the second period, why does the lower blood pressure become higher or lower? I will explain the real reason for that. To explain this reason, everyone please imagine you're back in middle school. Didn't you learn about Ohm's law in middle school? Voltage equals current times resistance. It's a bit hard to understand, isn't it? Voltage is like blood pressure. The pressure in blood vessels, in other words blood pressure, is proportional to the flow of current, that is, blood flow and resistance. If we apply this law and think about voltage or blood pressure, the systolic blood pressure when the heart contracts is when blood is pumped out of the heart all at once. In other words, because the current or blood flow starts circulating all at once, the voltage or blood pressure also rises. However, during diastolic blood pressure, blood flow doesn't circulate throughout the body, right? Since the heart has finished contracting and is now relaxing, the blood flow drops almost to zero, so the lower blood pressure means that as the blood flow decreases, the blood pressure also goes down. So, when does the lower blood pressure go up? The answer is, it's not because of increased blood flow. But when resistance increases, when does resistance go up? In other words, resistance is thought to represent arteriosclerosis, where the flexibility and ease of blood flow in the blood vessels decrease. During diastole, the aorta, which has expanded fully, contracts tightly and distributes blood flow to all the organs in the body. At that time, if the blood vessels in all the organs of the body aren't flexible and don't expand, the blood can't flow smoothly. Imagine it like a traffic jam. Think about when you're watering with a hose and you squeeze the end of it. Squeezing the end of a hose makes water come out with more force, similar to high blood pressure. And if the hose is flexible and you don't squeeze the end, the water doesn't come out with as much force. In other words, there's less strain on the blood vessels and the blood pressure is low. So what I'm trying to say is, when your lower blood pressure is rising, it means the resistance in all your blood vessels is increasing. In other words, the flexibility is decreasing, so the blood vessels can't expand or contract properly. This means arteriosclerosis is progressing throughout the body. It's an indicator that your blood vessels may be getting stiffer. Having high diastolic blood pressure may indicate arteriosclerosis. Having low diastolic blood pressure might sound like a good thing because it suggests your blood vessels are flexible, but that's not always the case. So in the third part, I'll clearly explain what happens when your diastolic blood pressure is low. It's easier to understand when you think about the reasons. And don't you find medicine interesting? If you believe what people say without knowing the reasons, you might end up with incorrect medical information. To help you avoid regretting getting the wrong information, I'll explain things clearly, including the reasons behind them. If you find this helpful, I'd appreciate it if you could subscribe to the channel. So, what happens if the lower blood pressure is actually too low? There's actually a term called the J-curve. Let me explain what the J-curve means. I have drawn a J here, and the horizontal axis represents blood pressure levels, from low to high. The vertical axis shows the risk of developing diseases. So, if the lower blood pressure is too low, the risk increases. At just the right level, the risk decreases. But as the lower blood pressure rises again, the risk goes up once more. This kind of relationship is called the J-curve. In fact, there is data showing that if the lower blood pressure is too low, the risk of death increases. A study involving about 23,000 people in France has reported these findings. Diastolic pressure is when the aorta expands to deliver blood to all organs. If it is too low, organs may not get enough blood, causing malnutrition and poor circulation, which could raise the risk of death. It's not good if the lower blood pressure is too high, and it's not good if it's too low either. And then there's also the upper blood pressure to consider. If you feel like there are too many things to be careful about, let me introduce you to one simple concept. That's what we call pulse pressure. It's simple. It's the difference between your upper and lower blood pressure. In other words, it's the difference you get when you subtract the lower blood pressure from the upper blood pressure. If the lower blood pressure is too low, the difference becomes larger, so the pulse pressure increases. In other words, the advantage of pulse pressure is that it allows us to look at the difference between the upper and lower blood pressure in just the right balance. The normal value is said to be about 40 to 60. It is said that the greater the difference between the upper and lower blood pressure, the higher the risk of your heart or brain blood vessels getting clogged in the future. So I think using this value called pulse pressure to check your own blood pressure is one way to go. Now then, what you've been waiting for, in the fourth period, let's actually see what your upper and lower blood pressure are. Which one should you pay attention to? I'll talk about the points you're curious about. Actually, the values you need to watch out for change depending on your age. For younger people, both the upper and lower blood pressure are thought to equally reflect the risk of clogged heart vessels in the future. It's often said that the upper blood pressure is important, but as I mentioned earlier, the lower blood pressure is also the pressure when the aorta and large blood vessels contract tightly. If the blood vessels throughout the body, which are at the ends of the branches of the aorta, become stiff, the pressure at this time becomes higher, so the lower blood pressure reflects arteriosclerosis throughout the body. That's why, especially for younger people under 60, if your lower blood pressure is high, you need to be careful. So what about people over 60? According to one study, especially for those in their late 40s and older, it is said that for every 10-point increase in upper blood pressure or systolic blood pressure, the risk of future blockage in the heart's blood vessels increases by as much as 15%. In addition, the risks of stroke, end-stage kidney failure, worsening kidney function, and heart failure, which is when the heart gets tired and can't pump blood throughout the body, causing shortness of breath or swelling, also go up. These results show that after your 40s, and especially after your 60s, upper blood pressure becomes very important. So what about lower blood pressure? In fact, it's believed that as you get older, lower blood pressure becomes less important. Just like the flexibility of the branches that come off the aorta itself gradually becomes stiffer. Imagine a balloon that has become hard. Because the balloon is stiff, it can't inflate easily. Since it doesn't inflate, blood flow doesn't really go through. And because it doesn't expand much or contract much either, it can't contract tightly to send blood throughout the body during diastole, so the diastolic blood pressure drops. In other words, as arteriosclerosis progresses and the aorta also becomes hardened, the diastolic or lower blood pressure will decrease. So even if your lower blood pressure was high in your 40s or 50s and you notice it's gradually going down, it could mean you've improved your lifestyle and become healthier, or it might just be that your aorta has become stiffer. And this is a bit complicated, but there's something called valvular disease. Your heart has valves that make blood flow in one direction, but if these valves malfunction, your lower blood pressure can also drop. So your diastolic blood pressure can go up or down and fluctuate with age. It's difficult to make a blanket judgment that it's bad just because this value is high or low. That's why for elderly people in their 60s and older, it's generally considered that the upper blood pressure reflects the risk of future blood vessel blockage. So what should we actually do? For younger to middle-aged people up to around 60 years old, you should pay attention not only to the upper blood pressure but also to the lower blood pressure. When you get into your 60s and become elderly, at that stage you should focus more on managing the upper blood pressure rather than the lower blood pressure. Now let's review what we've covered so far. High lower blood pressure may be a sign that arteriosclerosis is progressing throughout your blood vessels. As you get older, the aorta itself also becomes calcified and stiff, causing the lower blood pressure to decrease. I also explained that if the lower blood pressure is too low, as shown by the J-curve earlier, it can become a risk. As an indicator of blood pressure, let's pay attention to pulse pressure, which is the difference between the upper and lower blood pressure. I mentioned that the normal range is about 40 to 60. This is just a guideline, but for young and middle-aged people, both upper and lower blood pressure matter. I mentioned that for people over their 60s and elderly, the upper blood pressure becomes more important. So, what are the standard values for upper and lower blood pressure? Actually, the standards for blood pressure in health checkups have recently changed and are shifting in various ways. What kind of blood pressure should you aim for? And what foods are good for lowering blood pressure? There is a video explaining these topics, so please check it out from the description after this. Finally, I will introduce 5 important points you should know about the correct way to measure blood pressure. Measuring your blood pressure incorrectly defeats the purpose. If you get a falsely high reading and pay for it, you could take blood pressure medication with no benefit and just experience side effects. I've seen this happen to patients. Sometimes patients are surprised and say, "So I didn't need blood pressure medication after all." Please listen until the end. First, let's talk about how to choose a blood pressure monitor. If you've already purchased one, please use that. If you're planning to buy one, please use this as a reference. The basic type of blood pressure monitor is the upper arm type. In other words, it measures your blood pressure by tightening the blood vessels above your elbow. The Japanese Society of Hypertension also recommends this. If you're thinking, wait, I've been using the wrist type, is that okay? I personally think that's fine too. Blood pressure monitors sold on the market meet certain medical device standards. While there are some differences, all these devices reliably measure blood pressure. I recommend the upper arm type, but the wrist type is also fine. Nowadays, there are smartwatches that can measure blood pressure at the wrist and meet strict medical standards. And there are even products on the market that serve as both a blood pressure monitor and a smartwatch. Please visit a store and ask about what kinds of products are available. Now, let's move on to the 5 key points you absolutely need to remember when measuring your blood pressure. I'll introduce 5 common mistakes people tend to make. Here is the first common mistake. The first is measuring your blood pressure immediately after waking up in the morning. It might seem like a really good thing to do, right? Some people say, I'm told to measure my blood pressure in the morning, so I do it right after I wake up. But this can actually cause your blood pressure to be higher. When you get out of bed and immediately measure your blood pressure, it's right after you've moved and your body's blood flow is just starting. At that time, your blood pressure may be higher because your body is still adjusting. And when you wake up in the morning, depending on your environment, isn't it sometimes cold? When people are cold, their blood pressure tends to go up. When you wake up, warm up your room and sit quietly for a few minutes before checking your blood pressure. The second of the 5 common mistakes is this: measuring your blood pressure while doing something else. Please don't measure your blood pressure while doing something else. There were even people who, after waking up in the morning, would measure their blood pressure while brushing their teeth like this, or while sitting and smoking a cigarette. Some people say they measure their blood pressure in the bath because relaxing in the bath lowers their blood pressure. These kinds of things are also not really recommended. For example, smoking causes blood vessels to constrict, while taking a bath does indeed help to dilate blood vessels. So even if you measure your blood pressure at a specific time, you don't smoke or take a bath for 24 hours straight, right? It's important to know your usual blood pressure, so avoid measuring it while doing something else. Let's measure your blood pressure at a calm and relaxed time. The third of the 5 common mistakes is posture. Are you paying attention to your posture when measuring your blood pressure? Most people think it's fine as long as they're sitting in a chair. However, please pay attention to these details. Are you measuring your blood pressure while crossing your legs? If you cross your legs, your blood flow changes from usual, so please measure your blood pressure with both feet flat on the floor. And this is often mentioned, but it's about the arm cuff you use to measure your blood pressure. Please make sure to keep it at the same height as your heart. Your chair or table height might be too low or too high like this. Always make sure to keep it at the height of your heart. Some people measure their blood pressure while standing, but please be careful, because your blood pressure tends to be higher when you're standing. The fourth of the 5 common mistakes is measuring while holding something in. What are you holding in? That's right, you're holding in the urge to go to the bathroom. I mentioned that you should measure yourself right after waking up in the morning, but usually when you wake up in the morning, you want to go to the bathroom, right? It's better not to measure your blood pressure before going to the bathroom after waking up in the morning. Whether it's number 1 or number 2, when you're holding something in, the muscles in your bladder or rectum are tense and tightened. At times like that, your blood pressure tends to go up. So, when I instruct my patients on how to measure their blood pressure, I tell them to go to the bathroom after waking up, then sit down and relax and measure their blood pressure before eating breakfast. If you keep in mind to measure your blood pressure after going to the bathroom and before breakfast, I think you'll be measuring it at the right time. Common mistakes people make. Top 5 mistakes. The 5th one is measuring your blood pressure while talking. If you don't have a blood pressure monitor at home, when you go to day service, when you go to the neighborhood association, or when you go to the bank, you measure your blood pressure. Some people are like that, but it's just because talking with everyone is fun. Some people say, I wonder if my blood pressure is high again, while checking it. This can also be a cause of high blood pressure. In the first place, when you're talking, your emotions tend to be elevated. The sympathetic nervous system can become dominant, so blood pressure tends to rise. And another thing, you're not out talking to people for 24 hours a day, right? You probably spend more time at home. That's why your blood pressure at home is actually more important than your blood pressure when you're out. That's because it reflects typical blood vessel pressure. There's even a term for this, white coat hypertension. When someone in a white coat wraps the cuff around your arm and measures your blood pressure like this, it makes you a bit nervous, doesn't it? It's said blood pressure often rises around someone in a white coat, so even if I don't check it at home, when it's measured at the hospital, if a patient's blood pressure is only high at the hospital, it may not be a cause for concern. I tell them to try measuring it correctly at home, and if the values are normal, they might not need blood pressure medication. People with white coat hypertension who only have high blood pressure at the hospital are still at risk for clogged heart vessels later. The risk isn't considered high because patients aren't in the hospital all day. Understanding the reason makes this clearer. I've highlighted key points to remember about blood pressure measurement. Don't check your blood pressure right after waking up. Measure it after using the bathroom and before breakfast. Stay silent and avoid activities like smoking or bathing while measuring. I also mentioned that you shouldn't measure your blood pressure while crossing your legs or standing. In addition, when it comes to the position of the cuff on your arm, please wrap it about 2 finger widths above your elbow. If you're wearing thin clothing, it's okay to measure your blood pressure over it, but if you're wearing thick clothes, please roll up your sleeve before measuring. Also, the tube comes out from the blood pressure cuff, so make sure the side with the tube is facing your palm. And remember, your arm should be at the level of your heart. Make sure to measure your blood pressure correctly to help lower your risk of clogged blood vessels in the future. How was it? It was a long video, but thank you very much for watching until the end. Please share your blood pressure, what your doctor has told you, how you measure it, or what you do to lower your blood pressure in the comments section. I think it will be helpful for other viewers, and let's manage our blood pressure together by encouraging each other and exchanging information. If you like this video, give it a thumbs up or down. Your feedback is appreciated. I've also discussed how to lower blood pressure without medication in earlier videos. You can find those in the description as well, so please check them out after this. Well then, see you in the next video. Lessons from my general medicine patients on how to avoid aging in your 70s. It was a bestseller in 4 Amazon categories and topped the gift rankings. In my daily work as a doctor, I learned from my patients. I compiled important ways of living and health methods into one book. I want to live healthily too, and this book is designed to inspire that feeling in you. It's on sale now and getting great reviews, so please check it out.